The outline for the session is that I'm just going to go through and do a very rapid sort of 15-minute summary of Arts in Health at FMC, all the different elements of the program that exist, and then we'll get each of the artists to talk a bit about what they do, how they do it, and then really over to Q&A. So I sort of was wanting it to be more of a sort of conversation. 75 people might be a bit hard for conversation, but, you know, just great to have a bit of dialogue going. Each of the artists, so Bindi Blacher, John Blines, Dave Chapple, are all artists that work on Arts in Health at FMC and represent different areas of practice within the hospital. So I thought that would be an interesting presentation or format for this session, because I know a lot of people are interested in how an artist works in the healthcare environment, and acute care hospital is a very specific setting. So just before I go further, I'd just like to acknowledge also that we're meeting on Kaurna land and respect the cultural beliefs and traditions of the Kaurna people. And I'm Sally Francis. I'm the arts coordinator down at FMC, have been for about 11 years now, but I've worked on the program on and off for about 16 years. So Arts in Health at FMC has been operating down at the hospital for 20 years now, which is fantastic. So it started in 1996, and it's really about making the hospital a more warm and welcoming place, as well as supporting staff in their work and promoting recovery within patients and promoting health and wellbeing generally. So as I just said, it's 20 years, so we're having a bit of a festival in October. There'll be a week of activity all day, every day, and we'll let you know what's happening, and if you want to tap into that. Fireworks!
No, there was going to be fireworks.
In the courtyard? That'll get people there. So just in terms of Arts in Health, FMC having been there for so long and being so well established, we've had the opportunity to mentor other programs, to be involved in the development of sort of policy work. So with the framework in South Australia, there was a partnership agreement developed between Arts SA and Health in 2008, and Arts in Health at FMC was able to inform that process. And based on that was really the catapult for the National Arts and Health Framework, which was endorsed by the Cultural Ministers' Council and all health ministers in 2013. So, and we've also done external consultations and we're able to do presentations to the consortium bidding on the Royal Adelaide. So it's great that a program that's so diverse, and we're the largest program in the country in terms of the diversity of what we do and how long we've been there and the number of people that work on the program. So it's great that it can inform and inspire other programs. So that's just a bit about the partnership agreement and the framework. And I think they have been really pivotal in catalysing energy for arts in health and in creating an understanding of the legitimacy of incorporating arts into healthcare delivery. So within the hospital, Arts in Health sits within allied health. We are seen as being a department in the hospital. John Hill, as most of you will know, as the previous Arts and Health Minister, is now our Ambassador for Arts and Health. And really a lot of the work around the partnership and the National Arts and Health Framework was due to John Hill taking the lead and pushing it forward. So he's been a fantastic advocate for Arts in Health. And in 2009, Christine Putland did a 2-year evaluation of Arts in Health at FMC. So there's a program report and there's also a model of practice which was printed out of that. A lot of that drawing on artists' experience of working in a healthcare environment. So there is a sheet on your seat which it can be downloaded online, but I'll just let you know the last bit of the address, pages, publications is actually wrong. So just delete that and go straight to the front page website. And I think it's in the section What's News, but that can be downloaded online. So this just sort of goes through the various processes, and I really just wanted to get this slide in, which Bindi gave to me, the cello. Fantastic. So just outlining some of the different phases of the program, and I always say when it started there was certainly an air of scepticism about having arts in a healthcare environment. You know, why have we got arts when we need new ECG machines? And the reality that, you know, the bucket of money it was coming from wasn't coming from that hospital equipment anyway. But then it went through a process of just accepting we were there, to embracing we were there, and now to being thoroughly embedded. So we have a patient referral system, and that has really now is dictating a lot of the way we work, how we work, and where we work. So responding to the patient referral system is a big part of what we do. This is just a sort of a summary of the services we provide on each day. So each day there are different artists working, and they will get out to see a patient who's been referred, or else we'll wander around the wards as they practice, or run specific groups, as Bindi, John and David will talk about. We've got two main galleries and a community gallery. So they have art exhibitions that change every 2 months. We take a 25% commission on the sale of artworks, and it's an interesting environment to be exhibiting because you've got it's in the main corridor. 20,000 people pass through FMC each week. We always say we've probably got a higher visitation rate than the Art Gallery of South Australia. And it's an interesting audience because there are people who've never walked into a gallery before, or actually stood and, sort of looked at a work of art or an exhibition, to some people who might have beach houses at Henley Beach who are art collectors and art lovers. And so it's a beautiful space to exhibit. It's very non-judgmental. The main reason for the gallery being there, though, is as a distraction, a place of reflection for patients and visitors and staff to go. We try and have an Aboriginal art exhibition each year, staff on show, artwork from local artists, as well as we engage with the Fringe and Sala, and so we try and have a whole range of different exhibitions rotating. So we have got a number of public art commissions. There is actually an art walk that goes around them, and they often have been done through interactive artwork. I don't know if Bridget is here, so Bridget was responsible for orientation mosaic at the bottom there. So in any of those, we try and have a participatory aspect. The work at the top actually was formed by 400 people's handprints at the Reconciliation art event in, I think it was 2009. So we have live music. Every week we have musicians that come in. They go through 2 or 3 wards in the hospital and do a public performance. And Izzy, who runs the art program, is sitting right there. We have a harpist. In fact, we've got 2 harpists at the moment working 1 day a week. They play regularly on intensive care, the infusion suite, dialysis unit, as well as taking patient referrals. And the harp is an instrument that you can take anywhere. I mean, the music goes according to what the instruments are, the number of people. You have to be quite careful about where you choose to, for the musicians to play. The harp is universal. There's nowhere you can't take the harp. And there is actually there's a whole discipline of harp at the end of life called thanatology, which is very well established in the States. And Lynn has done the Harp for Healing course. Sound for relaxation. So Heather Fran works 2 days a week in the hospital runs a Sound for Relaxation program. So she plays Tibetan singing bowls. She uses her voice and guitar, and she'll take patients into states of relaxation and works with staff as well. So this often can be just a one-off contact. It can be an ambient thing, like an intensive care, playing to the whole ward, or she might have a long-term engagement with a patient over a number of weeks or months, and often has some really quite moving and deep experiences. Last year there was a patient, Brenda actually on the oncology ward, that Heather played for, and she would take the vibrations of the bowls to her tumour, and Heather taught her how to play the bowls, and she loved it so much her husband bought her a set of singing bowls, and it meant that she was in control of using these bowls and actually relieving pain. So she needed less pain relief because she was able to use as singing bowls. When she died, the bowls were placed on her coffin at her funeral, and her 15-year-old daughter inherited them, and Heather taught her daughter how to play the singing bowls. And the family say it was a fabulous way of them actually engaging with their mother through her death, and then it continuing afterwards. Heather also does, this is a film we produced last year called In the Moment. It was made by Harry Tregilgas, who's an honours in film student, around the sound and music program at FMC, which was launched by Rolf de Heer last May. It's a fabulous 14-minute documentary, and we have got it for sale over there. It's got a whole separate DVD of about an hour and a half of patients and staff mainly talking about the program and their experiences of it. So if you'd like a copy, we do have copies there. Heather also does meditation for staff, so we do a lot with staff for sort of health and wellbeing, and it's a bit like I was saying before with the sort of picky ball sticky photographs. It's sort of like, where does arts in health stop? But we do organise a lot of meditation and a lot of yoga for staff, and certainly, again, as I was saying before, within transforming health, that actually has really added support for the program, because supporting staff through these changes is really critical. I mean, staff are stressed and there's a lot of uncertainty around, so having programs that support staff is really critical. And the meditation, we run meditation free on 3 days a week, plus courses, 6-week courses, and meditation retreat days. So the last retreat day off-site on a Sunday was booked out in 4 days, 25 people. So it's really becoming incredibly popular. We also do yoga, and Kat Worth, Kat's doing a session later. We've just started 5 rhythms for staff as well in the hospital. We have an art trolley that rolls out 2 days a week, and it's just full of a variety of art supplies. And Kate, who runs it, will just respond to each individual patient as to what they want to do or what the need is. Kate also does workshops on 5J, which is the Hive Security Locked Ward, and the Margaret Tobin Centre. So we work across all areas of the hospital. As I mentioned in the previous panel, we have nurture packs, which are given end-of-life care to support patients and their families through that period. And also the art packs, I should mention, because the referral system just got so busy, there was no way we could actually get an artist out to each referral on that day or even the next day. So we've devised a whole series of art packs, and we at least get an art pack to somebody on the day they're referred if we can't get an artist there to visit them. And the art packs, there's acrylic painting, charcoals, a whole range of mandala colouring in kits, and again, depending on the patient's interests and abilities. So Bindi works as art therapist 2 days a week, and I'm not going to tell you anything about what she does because she's going to in a minute. David works as a writer in residence at the hospital. I'm not going to tell you anything about what he does because he'll tell you himself as well. We have quite a lot of student placements. So for 6 years, we actually ran a program with the medical students at Flinders Uni. So they did a 6-month, it was only one afternoon a week, but a 6-month residency at the hospital. They worked mainly on a museum object handling project, which we did in collaboration with University College Hospital London, which was a patient enrichment activity. And it was fabulous for the medical students because they were going to a patient, not taking something from them in terms of a diagnosis or information. They were actually giving something. And all the medical students who've gone through the program says it's completely changed the way that they actually regard a patient as well, because the patients would open up and talk generally about what their concerns were and, you know, what was happening in their life. And it's just this thing of, as a medical practitioner going up to that patient, they're not just their illness. You know, there is a person there that needs support as well. But we also have quite a few art therapy students, social work students placements. We run workshops in the hospital where we encourage the patients to participate, so it's a great way of obviously having a distraction while you're in hospital and learning new skills, as well as bringing people in from the outside. So we have had workshops where we've brought children in so that the children have a positive experience of being in the hospital. So if they ever do have to come in, this is a place that's not threatening, it's a place that is actually nurturing and cares about them. We've had numerous artists in residence. Avril Thomas was an artist in residence in operating theatres, and she painted 8 oil paintings and 40 drawings, profiling all the staff that go to make up an operation. So not just the surgeon, not just the anaesthetist, all the nursing staff and the PSAs and the CSSD staff that go to make up an operation. So it was really about sort of opening up the doors to operating theatres, and the operating theatre staff loved it. They were so proud of all those works. Another is Rebecca Cambrell, who was the Bride of Art. She painted for 6 weeks in the gallery in a bride's dress. She has a form of synesthesia where she actually, when she looks at a work of art, she hears music, or if she's listening to music, it'll dictate what she paints. But you'd get sort of 30 people there watching Rebecca paint, and they'd say, well, there's nothing there for children. And all of a sudden there'd be a galleon ship in the corner of the work, or, it was great to see this oil painting emerge, and that's a permanent installation in the hospital. Last year was our first Sala Artists in Residence, and again, I'm not going to talk in detail about this because John's here, but it was really so successful, and John is now really working almost permanently in the hospital, that we were able to offer another Artists in Residence this year, and that's supposed to say 2016, and Jessie Lum is sitting here, and Jessie's our current Artist in Residence, which is really fabulous. She's working in a very different way and bringing up all sorts of really interesting processes and lines of investigation, and so it's fabulous having Jessie 3 days a week until August as our Sala Artist in Residence. We've always had projects that run through the hospital, which are short-term projects, bringing in a group of artists over a short period of time. I haven't got time to go into detail about all of these. The zebra crossing, though, was really extraordinary. Lisa's work in the original format as a fringe performance was around a zebra coming from South Africa, which is what Lisa did, and being disconnected from her herd and having to re-establish herself and find new connections and feeling out of place. And when I saw it, I thought, that is just a patient in a hospital, disconnected from your familiar surroundings. And it was incredible as the zebra danced through the hospital, how patients they would be in tears, they would reach out to stroke her. There was this immediate identity with the vulnerability of this animal. So it was a very beautiful project. And there was another element to it with them receiving the zebra passport, with their passport photo taken with the zebra, that they could then share with family, and had reflective art activities in. So it had sort of a life beyond the original performance. 24 Hours was a film dance project which was about, and Kat was one of the lead artists, in fact that's Kat who's sitting here, who's doing 5 rhythms. This project was really about the fact that the hospital operates 24 hours a day, and it's full of busyness and quietness and stress and fragility and a whole range of different emotions, but it never stops. So that was really about going behind closed doors and just sort of showing some of those things. We recently had an April Fool's Dance project. So this was around falls prevention techniques. The artist actually, the choreographers, worked in all these different falls prevention exercises into dance, a combination of dance scenarios. And there was a flash mob with staff in the courtyard. It was absolutely fabulous, like 60 staff out there doing this dance, all with these falls prevention techniques. And I have got the 1-minute film which I can show at the end if you're interested, but it went up on the SA Health Facebook page and had 7,500 hits in 12 hours, and it's now got about 10. It's really fabulous. So it was a real sort of education, raising awareness. They also choreographed a beautiful work for the wards, and as we went around, we were giving out information about falls prevention. So we have a program of environmental artwork. So this is about getting artwork onto the walls and out onto the wards. So we've got an acquisitioned art collection of about 200 artworks, but these are specific works that are specifically designed for specific areas in the hospital. And a lot of them are aluminium composite panels. They can be fixed directly to the walls. So for infection control, you don't have issues around dust gathering, etc. And they're laminated, so they're washable with solvents. So these are all the sorts of things in a hospital that you have to really sort of think about and consider. So I'd just like now to ask Bindi to talk about her work. Oh, it's exhausting.
Out like that just is quite humbling, really. It's cool, very cool.
So I'm Bindi Blacher and I'm the art therapist on this team. I call myself an expressive arts therapist because my background is in performance arts, in acting and music, and I still incorporate a lot of music with the work that I do as well as visual art. And that's dictated a lot, I guess, by the hospital environment. It's not quite as conducive for, although we do have dancers in there, you know, kind of acting kind of skills. But music works beautifully because it can travel through an environment. So even, for instance, if there's a patient that has hygiene restrictions, so you can't go into the room that they're in, you can play at the doorway and they still benefit from that, rather than, you know, visual arts is a little harder to kind of gown up, and it's not always possible to go in there. I work, I provide arts therapy interventions to the ACE ward, which is acute care for the elderly. I run a workshop. I work there 2 days a week. I run this workshop both days, and that's a small group. Often the participants have dementia or they're in transition, so they may have had an incident that's taken them to hospital and then they're on their way perhaps to a care facility or something like that. So sometimes I get ongoing patients that are there for quite a long time, and sometimes they're just in there for 1 or 2 of the groups. In that group, I do a little bit of moving to music, seated. Actually, we have had a couple of instances where people have leapt up and danced, but it doesn't happen every time. Sort of seated, stretching and moving to movement. Then I'll do an art activity, and then I'll sing some songs. And that structure, and the songs are kind of linked into remembrance therapy and that whole kind of model of intervention where people with dementia often can recall events from a long time ago easier than sort of more recent events. And I'll often have, for one thing, there's sort of the generation that I'm working with already has a vocabulary in singing together. So that's something that people used to do quite a lot. It's a pity it's not done more. So for them, it's not such a leap as it might be for some younger people to just sing along to the song. So I'll often have people participating in singing, which is good, you know, in lots of different ways. It makes them feel part of the group. Well, they are. It makes them part of the group, and also, you know, it gets the blood going, oxygen to the brain, you know, on those levels, lots of different levels. It's good. So that's one thing I do. I work, I respond to referrals, as do most of the artists that work here. So that will be across the hospital, but mainly I work in mental health areas, and particularly with people with eating disorders. So I work on the paediatric ward with that group, and also with the adults, and also at the day program, which is down at Brighton, which is a different day. I work down there. And with those groups, I do group work because it's evidence that groups are beneficial, positive groups are beneficial for that client group. Yes, so there's that. And also with the paediatric patients, I run a regular meditation, mindfulness kind of thing with little tiny bite-sized meditations that might be useful for them. Yes, I haven't stuck to my notes. That's good. So Sally kind of asked us a few questions to prompt what we would bring today. And one of them was, what qualities do you think are important as an artist or arts therapist working in an acute care hospital environment? Because it's interesting. It's a really interesting environment to work in, and very different from other environments that I've worked in. Particularly very different than private practice, which is kind of the ideal therapeutic environment. The hospital, you know, it's a medical space. It's very clinical. The people that work there are wonderful, and often I've such respect for the nurses, particularly that work in that environment, and the OTs, everyone. But it's quite a medical, it runs in this medical model which can be quite rigid and a little bit alienating for the people that are in there quite often. So what qualities? I think a warmth, so in counterbalance to that environment, I think it's important to have kind of a nature which is welcoming and can hold this little bubble of space that we try to create, even though there's kind of chaos happening all around. I think certainly needs a certain level of resilience, because you do come across things that are quite confronting quite a lot. Depends on your life experience as to what might trigger you or, be hard for you. But I think, I guess you need to be self-aware enough to have processes to deal with that stuff. I think versatile would be pretty much the top of the list, and I'm glad that I have a bit of a broader range of things that I can pull in, keeping the patient that I'm working with right at the centre of that intervention. And what do they need? What do they need right now? What's going to be best for them right now? And if that's the bottom line of how I'm working, then maybe they need to sing, maybe I can just play some gentle music, maybe they need to make some art, maybe there's a particular art process that comes to mind. Yes, versatile. But assertive. So within that environment as well, I think you do need to have a certain level of assertiveness in order to feel your own validity within that space and be able to navigate and negotiate through that model and say, oh, can you come back and do that later? Yes, if it makes no difference to the patient, can they come back in 10 minutes rather than interrupt a session? So kind of be the person holding that space. I feel like my time's up. What supports me in my work? My own self-guided research, planning, adequate planning and materials, peer support, professional support, and a wonderful team.
Good to know.
Yes, that really helps.
Thank you, Bindi, that's great.
Great.
Yep, I was just wondering where it was. Which is... Okay. I feel like I need to position myself within the arts community. So I'm an emerging artist. I graduated from Adelaide College of the Arts in 2013, and I have a multidiscipline practice, including printmaking, drawing, sculpture and photography, just to name a few. A significant influence on my practice is my diagnosis of cancer in 2005 and the on-flow effects of that on family, etc. It's both my muse and my inspiration to actually get involved in arts and health. As Sally said, I was the FMC Sala Artist in Residence in 2015. And my residency consisted of two projects, one being working with cancer patients within the infusion suite, and the other was working with cancer researchers within the Flinders Centre for Innovation in Cancer. I'm continuing those projects this year. With the patients, I had a book art project, and that was as broad as a project as anyone that knows book arts. It can be anything. What I did find though was that most patients don't have the mind space because of treatments and whatever's going on in their lives to actually participate. So it became more of a project where I was making journals or making clamshell cases or to store precious objects and that sort of thing. And it also became very much about that interaction between artist and patient. When I started, I went out on the wards with the team and saw how they operated. When I moved into the infusion suite, that's sort of a very what's the right words? Intense environment, and patients don't necessarily, once again, have the headspace to be listening to you when you come up to talk to them. So I set up within the waiting room and just worked at my practice, and it gave patients the opportunity to get used to me being in that environment, and give them the ability to interact when they felt able to. It was also a distraction for patients within the waiting room. And anecdotally, most of the patients that I did interact with didn't have, or didn't seem to have, the support networks there, friends with them within the space, friends or family, whatever. And the project, I must say, was also open to carers and staff within the space as well. Now, I consider it a privilege to be working in that space. My work largely focuses on my experience with cancer and the associated psychological impact of that, including on the family. So look at it as my process and working is as an inwards journey, looking out and working within the hospital facilitated a broader perspective. And during the residency, I did a series of portraits. Now they're self-portraits, but I don't see them that way. I'm just a representative of the patient, and this is one of those works. And it was in response to a patient saying to me, cancer changes you, and sometimes your friends like the old you. And that's my experience too, that cancer changes you, and that's one of the things that I'm interested in within my practice. The residency gave me the opportunity to consolidate my practice and give it focus. So as an emerging artist, that's a really valuable thing. For me, the value in art doesn't lie within the dollar sign that's attached to it. It lays within the interactions, which could be the artist and material, the work in the audience, the artist and the audience, and there's no more powerful interaction than the patient and the artist within the infusion suite in a project like the Book Arts. I'm not talking to my slides necessarily. Sorry, one more. Oh gee, I'm not going to get through this. Sally has posed questions, so I'll pick a different one to what Bindi covered. The constraints within the environment. There's obvious constraints, materials, noise, ethical considerations, etc. But I never have felt constrained within my practice. I've just set up and worked. And those human interactions that I was talking about far outweigh any constraints that you might perceive. I'll just go on to... That was one project that I did. And the other thing was working with the researchers, and I worked with, which is another area within arts and health, and Sally might bring up some more questions about this, I'm not sure. But I was working with a fantastic team led by Dr. Michael, and I have a practice of just sort of gleaning information and writing it down and sorting it. And this process led me to the current project that I'm working on, that has brought two researchers and myself together, looking at cancer, the psychological change, and epigenetics. So epigenetics is the environmental changes that can have an effect on your genetic system and how it genes express proteins and genes are shut down by the environment. Yeah.
It's a bit of a presentation in its own right. And John will be presenting at the festival in October, where you can hear more about his research work. Dave.
Thank you. Yeah, I will ramble from my notes because I haven't brought any. I think the hospital is probably the easiest and the hardest environment for a writer. I think it's the easiest because you come to people who are sort of interrupted from normal life, and they are thinking about the big ideas. They are thinking about love, family, health, life, home, all those things that are really interesting in literature. And I don't spend much time in the shallow end, I think, when I work with people. I'm always working in a meaningful way, meaning that there's meaningful content coming. I think the challenge for me in the environment is how much authorship I can give whoever I'm working with. When you work with somebody, and a lot of the work that I do is sitting, scribing, talking, prompting, there's always this notion that authorship is somewhere in between us. So it might be me putting stuff together and putting a shine on things, or it might be solely that person. And the closer I can get authorship to them, the better I feel I'm doing my job. The language of the hospital is fantastic in that on one level it can be really brutal. It can be that open a curtain, have you moved your bowels today? Have you eaten bed number 5? And the sort of pressure that the staff are under, and that sort of quick, sort of almost impersonal sort of interactions with patients that happen. And then I get this opportunity to come in and talk about family and love and hope. And of course, it is like shooting fish in a barrel. The second you engage somebody in those sorts of conversations, magic happens. It rolls out of people. Like John, I started by following Heather and Helen around, and it became really obvious that there was 2 levels of language. There was the clinical language that went around the place, and then with Heather it was the language of sound, and with Helen it was touch and colour and texture. And my first few experiences in the hospital were just writing up, collecting those bits of language and turning them into poems that happened from somebody else's sessions. And I've tried to kind of keep that going. I use prompts that I say that are always the deep end, that are always about big ideas, and try and push authorship as far away from me as possible. I think I'm most successful in that environment in the eating disorder unit. Like Bindi, I do a group session there. The writing is always fantastic. I say the writing is without a doubt every week fantastic. I just prompt. I don't tend to do sort of group poems in that. I tend to let the patients do the writing. The sadness of that is that it happens in that session. It happens in that moment. Beautiful writing happens, and then it's done. And as a writer, I'm not a therapist. I'm a writer. And that's always a kind of a little compromise for me, that beauty happens all the time in that space, and it doesn't always get a readership or an audience. But I'm coming to terms with that, and I think the other thing is particularly in the eating disorder unit, part of that program is that there's got to be a suspension of disbelief for those patients. They've got to put their faith in the nutritionists and the doctors, and almost sort of disbelieve themselves. I come in, I have no knowledge, I'm not a therapist, I'm not a clinician, and all I know about is writing, and they become the experts in that space, in their story. And I think that's the gift that literature gives people in that space. It's a wonderful environment to work in. It's for me, the gift and the thing that keeps me going is the quality of the writing. There's bits of writing that have happened in that hospital that have like knocked me off my feet, that kind of resonate through me for the rest of the day. And however hard it can be, and it can be hard, and it can be sort of emotionally quite wearing, it's worth doing for that. I say what gives me the opportunity to work there and what supports me is the organisation, the Arts in Health organisation. In the UK, I worked in Arts in Health quite a lot, and what tended to happen was I'd have a relationship with a particular clinician, and that would be my only kind of connection with the institution, and other than that I would be doing it to them and they wouldn't engage. Whereas when you work in Arts and Health, you know that you're connected, you're supported, there's safety nets, and you know that you're part of the institution. It makes a massive difference for a practitioner. It's given me a huge amount of confidence to maybe go into some areas of the hospital that I found really challenging. I wouldn't do that without the organisation behind me. I mean, institutions are, they develop their own language, and as a sort of lone practitioner to go into an institution and try and sort of moderate that or force it or change it, I think is impossible. I think it's really hard work, and you actually get the sense that it happens, and it's happened, and it will continue to happen because we're part of an organisation. So I think that's the reason I can do what I do there, yeah, that's me.
Great, thank you. I think as a comment to certainly the work Dave does is when he talks to someone, comes back to the office, writes up a poem only using that person's words, and often, especially on the aged care ward, they might be really in a really difficult situation. They've fallen, they can't go home, they're just confronting these huge life changes, or might be reflecting back on the war or whatever, and Dave will write up this poem only using those words, take it back up to them and read it back to them and give them the work. And I just think it's a really moving thing, and it's really validating people's experience, and it's not glossing over things. This is where they are now, and sometimes it's really hard, and I think it has a real benefit. So I'm sorry, we've all just sort of talked, and there's really only sort of a few minutes for questions. But has anybody got any questions for anybody? Yeah. Oh, there's a microphone coming, actually. Yeah. Thanks.
How are you?
Oh, all right, yeah.
Okay, Dave.
So
you
would
do
you like
get
to
an
just
audience.
say who you are?
Oh, sorry.
It's all right.
My name's Nikki Vuis, and I work for the City of Teacher Gully. I'm Arts and Cultural Officer.
Okay.
We do know one another.
Yeah.
From the Writers' Centre. So you do get an audience in a sense, but more on a one-on-one level. But if you were to expand the audience, how do you see that working within the hospital environment?
Well, it's difficult because I think one of the reasons that I get such good writing is because there's no pressure, there's no sort of readership, and it is in the moment. So I think to go into eating disorder ward where this writing happens and disappears every week, and to actually change that process and say this has got an outcome, and this, I think we might undo it, to be honest. So I think it might just be in that case that I accept that that's the way it is. We have done some displays of work, we have put some bits and pieces up, and there is obviously mechanisms to get people to put a release. And writing always suffers with outcomes. The process, I think, is brilliant, but the sort of print outcomes, I think that's always been something I've struggled with. So, yeah, I'm loath to sort of change that process, really. Just accept that's the way it is.
Joe, there's a question. There's two.
Do your clients actually do writing themselves, and also how do you engage clients whose language is not English or not their first language?
It's not been a massive issue in the hospital, to be honest. I've certainly worked with people with low levels of literacy but that's the barrier is usually confidence and motivation rather than ability. I use a lot of sort of spoken word techniques. I do a lot of scribing as well. A lot of what I do is just capturing, language and literature aren't two different things. People think that the way they speak is somehow this less sophisticated version of literature. if you can just capture it, even if it is, you know, sort of very broken, and reflect it back to them, they can generally see the quality. Away we go. I've just done a project with multicultural young people with English as a second language. We just did a lot of spoken word. They were terrified of the page, take them off the page, they just flew.
Actually, and I suppose that's with the patient referral system, that if there was someone who had no English, we probably wouldn't send Dave to them. We'd send some music or a visual art activity or something. Yeah.
I guess my question's mainly for Bindi and Sally. How do you find acceptance within the medical profession? Like, obviously you've got your own department and it's a really amazing situation that you're in. Do you find that you're having to push your agenda to be accepted, or is there quite an accepting persona around the hospital, do you find?
I personally bring it down to the interaction that's just happening right in front of me, rather than trying to, this is the manager's job, is to kind of do those other levels of finding our place within the whole hospital structure. I guess, yeah, my navigating is just around that interaction, and if there's you know, if there's procedures that have to happen, then yeah, my interaction's going to be broken, and I'll just accommodate what I need to, be really flexible, but at the same time ride that line and be assertive and go, well, just question it, like, is this necessary right now, or, you know, is there a space we can go which is going to be better, or, you know, just kind of navigating through. And also the people in the different environments make a difference there. So think of the wards that I'm in, there's a few key people that I know on side that I can kind of go, hey, what do you think about this, and navigate it.
I think just to add to that is that all the artists are incredibly professional, and Bindi, she's so well respected in the hospital that the clinical staff immediately respect that work that's done. I think we try and frame things in a way that is going to create not just an understanding, but that respect of accountability and professional practice. And I think when you do engage with the clinicians, they get really interested. Like Jessie at the moment is working in clinics, watching procedures, and is going to be going to theatres. But when she was in clinics, you know, the surgeons were like really fascinated. Oh, this is the artist, and they're explaining everything to her, and they're loving it. You know, so I think it's great. I mean, it can add to their practice too. So yeah. Sorry, there's a question. Probably the last one. We are nearly 5 minutes over, so if people have to go, then please feel free to do so.
Which one?
At the back, sorry. Oh, the gentleman at the back. No.
I'll do it.
Oh, God.
The lady in orange asked for a question.
This is towards, my name is Fiestas, and this is towards Dave. I was in Bali for the Ubud Readers and Writers Festival, and there was a poet and a prose writer, a novelist on stage with a moderator, and they said, what's the difference between poetry and prose? And the poet said, well, prose is like going there, and poetry is like being there. And I think what you said about people capturing that moment of reflection, I think, is the poet in those people being there.
Yeah, I love that, and I use so much poetry in the hospital. It's pretty much all I do, because it does have that instant. You don't need to get into sort of technical concerns. You can just capture somebody's register and put something real sophistication down on the page, and it seems to be the right tool. You know, it's made me fall back in love with poetry, to be honest, working down at Flinders. So, yeah, definitely, I love that.
Great. And there was just maybe one final question. Was there somebody further? Oh, there's lots. There was somebody else there. Yes, sorry, would you like to ask the question?
Just a really simple question. Sally, how do you engage in artists and people to be part of the department? How does someone become involved in the department to then do their work in the hospital?
I guess there are multiple avenues. quite a few of the artists that now work have actually done placements with us. So they've worked with us for a couple of months on a placement, and then something comes up that they might want to be, that they're interested in. The projects, having people involved in special projects, and then actually forming a position around a particular person. So that's also happened as well. And we've never actually advertised. A lot of it has been word of mouth or meeting someone that you can just see is going to fit in. The actual paid positions, we have artists that are on contract, and we have artists that are actually employed by SA Health, and that obviously has to go through the employment processes. But we have, it's a very wide network of people who have worked in the hospital or work with us in the hospital, and they also provide, those contacts. So it's there are formal processes and informal processes, and sometimes we have to go through the informal. A lot of what I do is navigating, the different, the arts and health are obviously operate in completely different ways, and I'm really not the meat, the cheese in the sandwich of actually working how to do that. And there's lots of ways I pick up on some of the health bureaucracy and just bend it a little bit, what they don't know. So, yeah. So, yes, if you want afternoon tea, I think actually we're going to have to finish, but thank you very much everyone coming, and thank you very much for Dave and John and Bindi.